Hello everyone, my name is Dr. Soumya Singh. Welcome to InnoHEALTH Magazine Podcast. And today our host is Dr. Shelly Mahajan, and she will help us understand about diagnostic and evolving technology under the field of diagnostic. So Dr. Shelly Mahajan is Lab Director at Mahajan Imaging Labs, a qualified pathologist with specialized expertise in molecular pathology. She has been instrumental in establishing and leading both molecular diagnostic and routine pathology service at Mahajan Imaging Labs. So welcome to the show, ma'am.
Thank you.
So how was your day? What your day usually goes?
So I am basically a working mother.
Okay.
My day starts with sending my children to school and then come to work.
Mm-hmm.
Like any working woman, go back to the children and then the day ends like that. Yeah.
So what's your since you started your career until date, how has diagnostic field has evolved?
So I think diagnostics has really transformed in the past decade or so. So traditionally how diagnostics used to be, in fact I would say diagnosticians were not even considered doctors by some patients. Right? Patient would fall sick, they would go to a nearby doctor, the doctor would write some tests, the patient would wait for the test results and then goes back to the treating doctor. But I think today diagnostics is the front and center of not even sickness, but prevention, prediction, monitoring of disease, and the overall prognosis of the patient. There have been revolutions in molecular diagnostics, genomics, or even imaging, or consumer-facing testing kits like at-home kits. Be it glucose monitoring or PCR. So there have been immense revolutions, and because of that, I think now diagnostics, the role of diagnostics is not just diagnosis. It's prediction, prevention, and management of the entire disease. So that entire journey of a person and not just a patient, where the person is now also focusing on prevention of a disease. I think diagnostics is a major part of every household now.
Definitely. Since you mentioned about molecular pathology, can you shed a light what's molecular pathology? How does it work in the field?
So molecular pathology basically, if you would ask me a few years back, I think a layman would not even understand the term. But over the past few years, I think PCR has become such a household name. So it still is a very specialized test, but fortunately with the evolution of diagnostics, it is more accessible now to routine patients, wherein we can diagnose a disease or susceptibility to a disease just by taking or testing the DNA of the patient. It can be, and the DNA can come from a blood sample, from a swab sample, saliva, anything. So that way, in terms of disease diagnostic accuracy, prediction, and prevention, molecular diagnostics, and in fact speed of diagnosis. Molecular diagnosis has revolutionized diagnostics in all the fields, be it cancers, infections, autoimmune disorders, anything.
So since we are in the age of era of AI, so how AI is transforming this diagnostic field, and also how you are managing the biasness, the errors, how you counter that.
So AI, I think, is reshaping the future or the presence of diagnostics currently. Right from if we start talking about the diagnostic accuracy, AI is supporting radiologists in identifying or detecting cancers or benign lesions, lung nodules, everything at a very early stage, which is at par, if not better, with the human expert radiologists today. Similarly, in pathology, if we talk about AI, we are reading histopathology slides which would take hours for a pathologist. AI can do, or at least screen the slides for the pathologist in a much faster, and the error rates are much lower. We are using AI for pap smear, nowadays first pap smear screening. How it helps is in underserved areas where there is a significant lack of expert availability. So there it helps in screening, it helps in workflow efficiency, it helps in reducing diagnostic delays and triaging also. Overall, what it does is basically improve the diagnosis in terms of accuracy, in terms of time, hence improving patient outcomes and eventually the cost to the patient. Now, of course, as much as we celebrate AI, it's critical to understand that it is not immune to bias, right? If the training data set, if how AI algorithm is built, just want to put some light on that, an algorithm is made and then it is trained on certain data sets, right? Now, if that data set is not diverse enough, if that data set is not of high quality, by high quality in AI data, we mean that it should represent all the populations, all the ethnic groups, all the age groups, gender. If it is not representative of that, there will be a lack in quality of it, or the data will be skewed, and which would reflect in eventually in the results which are provided by the by the AI. So it's extremely essential to focus on when we are building the AI algorithm. It's extremely essential to focus on and take time in preparing and training of the data set. It is absolutely non-negotiable, to consider diversity in AI data sets, in the training data sets for AI algorithm. And apart from that, I would also say that human oversight is still very important.
Yes.
Even if AI can do a job today much more efficiently and with much more accuracy, but still, till today also, for example, a radiology report should not be released without a final say by the radiologist. Also, I would say that there should be a continuous validation of every AI algorithm.
Yes.
An AI algorithm which worked last year or 5 years back may not work today that well because disease patterns change.
Yes.
Right? Disease patterns change, populations evolve. So that continuous validation is important to avoid misdiagnosis using AI. Also, transparency and regulation is important. Every step of AI development, AI validation, every step should be well documented, and there has to be, which currently is also lacking a little bit, more regulatory compliances should be involved in AI. So yes, definitely AI is the future, and I always believe in using technology. So I would say it is a very, very important aspect in breakthrough in diagnostics, but it has to be also known that AI is not here to replace clinicians.
Yes.
It is only there to augment the function of a clinician and help the clinician use clinician's time and mind in something else, right? So human touch is still very, very important.
Since you mentioned about regulation, so like being a patient, I'm also one of the patient, like diagnostic is like every other day. So when I get my lab reports from one lab, then I get from different lab. I see there is difference in biological reference range. So how we can make this reference range as well? Like I'm talking about standardization. So how important is that, and how can we achieve a standardization in the field of diagnostics?
It's extremely critical. Like you rightly said, imagine getting a simple cholesterol blood test done and getting variable reports from different labs. It induces a lack of trust from a patient point of view. The patient is confused what to do. Sometimes may lead to inappropriate treatments and misdiagnosis also. So that's why standardization is very important. It's important to create a comparable and trustworthy diagnostic infrastructure in our setup. For that, it's highly recommended to be very selective in where the test is done, because we need a lab which follows certain international quality standards. For example, ISO 15189, which is called NABL in India. That standardization, it creates a standardization in the system. because it would follow proficiency testing, regular proficiency testings, and where we compare our results on the same sample across India. So we know that our results are comparable with our peers. Then regular audits should be done. Audits should not only be considered a part of just a documentation. No, this should be seriously followed, and that really helps in improving the workflow efficiency also of the lab. Also, I would say we use controls and a thing called controls and calibrators in all our machines. There should be traceability in those controls and calibrators, right? They are, we should not compromise on that because of the cost. So that is very important. Fourthly, which I very stringently follow, is continuous training of the staff, competency of the staff. Continuous training, them knowing the new technologies or new, following that, adapting to that. It's very important. So I think all these steps should be followed to rebuild the trust and to maintain the trust of the patients on a certain lab, and for the diagnostics to actually help the patient in terms of rapid diagnosis, accurate diagnosis, and better treatment outcomes.
So one more common thing, patient usually face is that when they go to one doctor, he said get their blood. Today nowadays people are so much concerned about their health. They get their blood test or whatever they can then on themselves. So when they go to certain doctor to show their reports, they didn't don't accept that report. They suggest get from certain labs. So what's your point of view on over testing or unnecessary diagnostics? How can we minimize this thing?
Right. See, over testing is a real issue. Even though I am from the diagnostics side and it should not bother me, but it does bother me because it's a science. It's basically used for certain things, and for it to become infamous is not nice. It is becoming infamous because of this reason only. The lack of trust. Why is the lack of trust there? It is because of our previous point, right? Where there are labs which are not following accreditation policies or quality policies. That leads to a lack of trust in the clinicians, right? So I don't blame the clinicians for that. That said, over testing is a real problem here. It leads to patient anxiety. Like the scenario you mentioned, imagine the anxiety that the patient must be going through. That my report is not right. Where do I go now? Right. So apart from patient anxiety, there can be misdiagnosis also, or because of false positives. More you get tested, there are more chances of getting false positives because you're not trusting what to trust. We don't know. And also, of course, cost implications are there. So to avoid that, there are certain clinical decision making tools which should be used for the clinician to guide the clinicians of which test should be ordered when. Right, the clinician knows the disease.
Yes.
A diagnostician is an expert in what particular test should be used in this particular case.
Yes.
So for that, there should be a constant communication between the clinician and the diagnostician also. Secondly, I would say there are evidence-based guidelines, which basically discourage routine testing when they are not required. So every evidence-based means that there is evidence that if this is the scenario, this test should be done. But along with that test, 10 other tests do not need to be done. So that evidence-based training and the guidelines, understanding of the guidelines should be there. Thirdly, I would also say that it is also a patient-based problem. Sometimes patients come to us without a prescription and they want to get a test done.
Yes.
Because one of the relatives got this, so I also want to check. Till an extent we can discourage the patient, but after an extent we cannot. It's free will, right? So there are no guidelines where we say, we won't do a test without prescription unless it's a prescription, unless it's that kind of a test. So because of that pressure also, I think sometimes clinicians have to write a background test. So I think the awareness of the patients is also very important. That the certain test is only recommended in certain scenarios. So I just, like for example, when patient come to us for a BRCA testing, just like that.
Yes.
I would like to take a detailed history, and I would only recommend the test if the history suggests that okay, there might be a chance of hereditary cancers in the family. So that training is very important, and we need more focus on value-based models instead of volume-based models, which means that instead of focusing on the number of tests that the prescription holds, we need to focus on the tests which are providing some value in the treatment protocol of the patient. So I think we need to focus more on smarter diagnosis and not volume-based diagnosis.
Definitely, and stop watching reels and get those tests done.
Don't follow Google or
Yes.
University. That's
Yeah.
what we say.
Yeah. So, recently we heard a news about Apple Watch saved a patient. So, what's your and one news came because of wearing this kind of devices that the waves radiations, we also expose ourselves So, what's your opinion on point of care diagnosis with wearables, biosensors? Does it will change traditional labs?
So, point of care diagnosis is a very interesting question, and I think the answer is both yes and no. Point of care testing definitely improves access to healthcare.
Yes.
Right? Especially in underserved areas, be it routine, portable PCR platforms. There are glucose monitoring. Then in fact, portable X-rays also. It's very good in certain situations, especially when we need immediate diagnosis in emergencies, in rural areas, or at home. But that said, it cannot replace the traditional lab tests model, primarily because of quality control. Still, for a good quality, accurate report and high complexity testing, the lab infrastructure is required, especially in diseases like cancer genomics or autoimmune diseases or infectious diseases where culture is required. So we need good quality control, good accreditation, good standardization, which can only be provided by central labs. So I think, in my opinion, it's going to be a hybrid model. We cannot deny the fact that in certain cases, point of care testing can flag the person. For example, in glucose testing,
Yes.
that okay, now it's on a rise, I need to do something about it. But for complete diagnosis, I think traditional labs would still be always be required, because that quality control is not possible after an extended point of care testing. So I think both the approaches would work parallelly, working with each other to provide the best diagnostic care.
And what would your thoughts on this kind of new wearables kind of devices?
Wearables.
Yeah.
So definitely, so there are wearables for glucose monitoring, hormone testing,
Yes.
and hydration. So these are, I think, the next revolution, and the revolution that is being created. I am in full support of these devices. That said, we need to understand that they are only providing an idea. A glucose on a wearable device, as of today, I'm sure there will be improvements, technological improvements in future, but they are very good for monitoring, but they are not good for diagnosis. I would not, for example, change a patient's treatment plan of diabetes based on continuous the wearable devices, but I would still ask the patient to keep monitoring the glucose levels or heart rate or hydration levels, to access the doctor in need. That said, wearable devices are definitely moving on from just counting of steps to these things. So it's a very very good revolution that is coming, but still cannot replace traditional labs.
So what as per your opinion, what technology in the field of diagnostic will be a big breakthrough?
I think there are many emerging breakthroughs that are coming, but to name a few, I think I would personally talk about, and I'm very excited about, is multi-omics diagnosis. Multi-omics diagnosis is basically where we are combining 3-4 sciences together to come to a complete diagnosis from a simple blood test. So it would include your genomics, proteomics, metabolomics, microbiomics.
If you
It's a very technical thing. I will not go into details, but these are basically the study of a patient's cell from all the levels, from the proteins they are creating, the genetic level, then the effect it is having on your metabolic system, and effect it is having in the good microbiome, microbes or bad microbes in the body. So I think all of that combined, it's called multi-omics approach, and it would be. So today we talk about personalized medicine, right? When this comes into picture, we will be talking about ultra-personalized medicine, wherein by a simple blood test, we'll be able to predict the disease, we will be able to detect the disease early, and if it's, for example, a cancer, we will be able to subtype the cancer, and in fact also recommend treatment options, tailored treatment options for the patient. So, and to improve patient outcome, to improve diagnostic efficiency. So I think that is one very important breakthrough which we should be able to see soon. And secondly, we spoke about continuous diagnostics, the wearable devices. That also is it is also continuously improving science here. I am total pro of combining technology with diagnostics. So I think that is also very important breakthrough, and there are people working for improving that. Like it started with sugars. Now there have been studies on hemoglobin levels also. So I think the continuous improvement of that is also a very important breakthrough. And of course AI-based diagnostic tools. To improve the efficiency of diagnosis. That is something which is, be it a solar-powered PCR to help the rural areas, or smartphone-assisted microscopes. They are AI-powered tools are really improving the access of healthcare to all the areas of diagnostics. So I'm really excited about all these things.
So recently, one controversial, I guess, news came in Pune. They have a template of they collected the blood, but they have a templates of reports which they share with the patient. So this also have this ethical challenge which I can diagnostic labs or a person has doubt am I getting a template all the bloods that I'm giving, where that blood is going, and is my data my patient data is safe or secure or not, is there or not, and so much doubtful has created that news has specifically in the now when the patient knows they have a doubt I this blood I have a cancer or I don't have a cancer. So what's your opinion in that?
So I think it all comes down to trust.
Yes.
So and all the topics that we have talked about today that lead to a distrust, like I said, over testing or not getting quality accreditation for your labs. And in fact, during COVID also we realized that there is the trust on diagnostics in our country is so fragile. We have come a long way, but still it is so fragile that there are differences in recommendations and everything. So I think I only believe that fair practice and to gain that trust of the population, it's very important to not think about the cost and think more in terms of quality and standardization of the reports. The distrust that we create ourselves is because we are not probably following the quality protocols. If there is sometimes because of some technical glitch, a wrong report is going out, pick up the phone, talk to the patient, recall the report, explain, and be transparent.
Yes.
All the patient wants is transparency, I feel. And that's my advice to all the new labs coming up. Even if you make a mistake, don't try to hide it with another lab. Just the patient these days, they are, they are not like 10 years back. They are very much aware. We are practicing in an era where patient wants quality also, patient wants a good turnaround time also, and patient wants to talk to the doctor also. And that makes me happy because, like I said, 10 years back, probably a pathologist was not even considered a doctor by a regular patient.
Yes.
But today the patient wants to talk to us to discuss the report. So I think give the patient that time. They are paying for a test. Give them, and they are anxious. Nobody gets a test done, to celebrate something. They are getting the test done because they're anxious about something, right? So give them that much time. So that gaining that trust is on us. It takes time, but I think a fair practice helps us.
So, since you mentioned in your answer about the pandemic, so during pandemic, major gaps have been identified. What are all gaps you think are still there in the field of diagnostics? Which was huge
Yeah. So I think pandemic was a real stress test for diagnostics. Though I would proudly say that we did, prove ourselves and as an entire diagnostics of the country. We were, I think, the only country which was providing RT-PCR reports in a few hours. Till the longest time, and in fact till the end, no country was providing such fast reports. So I think that way we have done well, but still there are major gaps which need to be filled. Firstly, scalability. Though we did scale, there were labs opening overnight, but is that good or bad? Without any proper structure of how the quality approvals will happen, what are the certifications that are required, I'm not sure whether that is okay unless there is an emergency like that. So I think scalability is still an issue. There are supply chain disruptions which happen. The demand is there. Like for example, in pandemic only, there were times where we didn't even have, our vendors could not provide us with sufficient PPE kits or swabs or the VTM vials. So on those small things also matter a lot. So that was a major supply chain issue that we faced. Also data fragmentation. I think it's important to have or work on a system where the patient reports are not fragmented. Something is done here, so it's here. So, there has to be a system where the patient can access all the reports with ease and avoid unnecessary testing, repeat testing in various labs. So that is also one thing. And also here again I would comment on the fragile trust that patients had on diagnostics at that time. There were discussions that the patient would question reports. I don't blame them because there was sufficient lack of standardization. I'll give you a very simple example. CT value has, so RT-PCR is a qualitative test. We are supposed to say is it positive or negative. But because somebody started giving CT value, there are multiple variables which can affect my CT value. It is not really
because of COVID.
Yes, it's not really because of intensity of the disease. But because few labs were giving, there was no standardization there. Everyone had to give because the patient wanted that. So it became more of a demand and supply situation. So I think the trust, to build that trust, we need to work on ourselves first in terms of quality. It's very easy to set up a lab, but to build it on quality is something which requires a lot more focus. Also, we need more public-private partnerships and standardization over there also. And of course, global investment in healthcare. We cannot talk about equitable healthcare and not talk about diagnostic equity there. So these are a few things which need to be kept in mind there.
So one last question: if you would like to know, if you had an opportunity to redesign the diagnostic ecosystem, so what changes you would like to do?
So I would firstly want to work on interoperability. I'm again and again stressing on that point. Interoperability is basically if the patient that gets a test done in any lab, it should be similar. Secondly, the data should be, it should not vary that much. So interoperability, which comes from standardization and good quality control and following the similar quality guidelines. So that is very important to change the landscape of diagnostics in the country. Also, I think I would say, apart from that, realigning incentives. The focus should be more on value-based testing and less on volume-based testing. We should not be, the reward should not be based on how many tests were conducted, but reward should be based on how many tests were appropriately conducted. So these are the two major things. Of course, we need to work more on continuous training of our staff. Because the technology is advancing at such a speed that my training of 10 years back will not probably help today. So the continuous training, at work training we do for our staff, that should be required, and adaptation to new technology. We should not be stuck in the old ways. It's not how it works. Right from from logistics, sample collection to report delivery. We need to adapt good technology. We need to be open to upgrading of our systems. So like at our labs, in our institute, we are continuously upgrading our systems as and when it comes in the market. We have also validated new equipments which give a promise of good quality and faster healthcare. So there are two main things. The patient should get a good diagnosis and the patient should get a faster diagnosis. This is possible with technology only. Continuous improvement is possible with that. So be open to that. So, and I think and the regulation around those new technologies, it has to be strict for sure, but the time taken to accept that from a regulatory point of view should not be so much that the next cycle of technology comes in by then. So that on the field regulatory compliances, they are very important. So in short, I think adaptability and openness to accepting new technology at a country level is something I would like to promote.
So thank you so much. So that's for today's podcast. And please like and share and subscribe to our channel. Thank you so much.